listeners and viewers, my name is Trish Murphy and I'm with the Orlando Medical News, and today we're with Dr. Scherer of the Florida Radiology Specialists of Florida, and today we're going to be talking about back pain. So Dr. Scherer, I'm sure one of the most common questions patients have is, at what point should I go see a doctor regarding my back pain?
So there are two ways to answer that question. So the first is knowing that most back pain is self-limited. So that means that over a period of time, typically 2 weeks, the pain will resolve on its own. But if your pain doesn't get better after that 2-week period, then you should definitely go to see somebody. Other things that you would probably want to see somebody would be if you have numbness, tingling, and weakness associated with that, particularly if it's on one leg or both legs that you're having that numbness and tingling and it goes beyond the knees, as an example. The other scenario that you always want to be mindful of are the ones that you necessitate seeing a physician even earlier than 2 weeks. So we call these kind of red flags. So those scenarios would be if somebody had trauma prior to having the back pain. Absolutely, you need to see somebody. Another thing would be if you had a fever, because you can have an infection that's causing that back pain. We call that osteomyelitis discitis. The third thing would be if you started to have bowel and bladder incontinence or symptoms related to your bowels and bladder. Those are all things that will require seeing a physician emergently.
So Dr. Scherer, talk to us a little bit more about what are the most common causes for our back pain?
Okay. So you can break it up into a few categories. The first one I would start with would be muscles. So you have muscles that surround the spine, the bone of the spine. And those muscles can have a strain in the muscle or a partial tear or even a full thickness tear in those. The second area that we think about, and is the one that's the most classic that people worry about, is the disc. So when we talk about herniated discs, protruded disc, and what happens is over time, the discs that are in between all the bones or the vertebral bodies of the spine, they can become weak over time, lose some of their height, and then slowly protrude out into the spinal canal region. And so because of that, it can impinge on some of the nerves or cause stenosis or narrowing of the spinal canal. The other etiology is classic arthritis. So the spine, the bones in the spine, they're joints in between different levels of the spine. And similar thing, the arthritis can form and then it can impinge on the spinal canal or the nerves that come out of the canal. And then finally, it's etiologies that are just either you're born with or you acquire over time. And then one of the classic ones can be scoliosis. So because of that abnormal curvature that you can have in the spine, you can have discomfort and pain from that as well.
So Dr. Scherer, now let's talk about risk factors. What are some of the things that kind of contribute to our back pain?
So there are a couple things. So first off, age is one of them. So even as we get into our 30s and 40s, you can start to have more back pain just because of the wear and tear over time that happens. And what we talked earlier about how those discs can start to lose some of their strength over time, and then you get the herniation. Other things which tie into prevention have to do with exercise and weight loss. So if you if you have a good set of muscles in your back and even in your abdomen that supports your back as well, doing that exercise can be a critical thing. So people that exercise, they're in good shape for that. The counter to that is sometimes if you have excessive weight, particularly in the abdominal region, that can weaken over time the strength of your back as well. The other ones to think about are sometimes when we do certain exercises. So I know classically the thing that I think about is not lifting with your knees.
Right.
So a lot of people, when they do certain lifting, like if they're moving somebody, they may lift something and they don't use their legs to do that. And so they put excessive force on their back, and now they're in trouble. So those are kind of the more common ones that are important for that.
So now on to a part of this that applies to every one of us, and that's prevention. How can we prevent back pain?
So there are a couple ways, and a lot of them have to do with active measures on our part. So first has to do with exercise. So any exercise that you can do, even if it's weightlifting or just active walking, things like that, but basically to increase your core muscle strength in your abdomen, but also in your back, that will help because it's supporting the bone that makes up the spine. The second thing would be maintaining a healthy weight. So again, that is tied to exercise, but also choosing the things that we eat appropriately is incredibly important. A third thing has to do with flexibility. Being flexible and doing exercises like that will also offload some of the pressure that you put on the spine. And And then finally, it's being smart about certain things. And two of those have to do with both how we sit and then also what we do when we're like lifting things. So there's so many things that have to do with the ergonomics of how we position our bodies when we're sitting in typical environments, and we're actually becoming more of a generation that sits.
Right.
You know? And so to be able to do that cautiously and do it in the right way is really important. I know some people will actually, and especially in our workforce in radiology, you know, they'll maybe work at a workstation that's elevated so that they're standing throughout the day and also sitting. So just things to be smart about how to prevent that as well. The final thing too is what we referenced earlier about when we're lifting. So lifting things in the smart way. So don't put all the pressure on your back. Make sure you lift with your knees is critically important. So those would be the main things to help.
Great. So it sounds like back prevention is something we have to do every day.
Absolutely, absolutely.
Now, on to the most important part. At what point is it necessary to get a radiologist involved with back pain?
So typically, with most of the back pain, it is self-limited. So after about 2 weeks, most patients will have no symptoms and it'll resolve on its own. The scenario where you want to start thinking about getting radiology involved include things like, if let's say that it takes 6 weeks or so, and you're not any better with your symptoms that we discussed earlier, then you can start thinking about getting an X-ray or a CT or an MRI. And what's nice is to help the ordering clinicians that will send patients for us to evaluate them. The American College of Radiology or ACR has guidelines, or appropriateness criteria is what we call it, that literally tell them step by step, okay, if these are the symptoms, this is how long they've had it, this would be the best test to take or to have the patient have and minimize radiation, so forth and so on. The other component of that is those that would need imaging even sooner, so not waiting that 6-week period. Those would be patients that, for example, if they had a history of trauma, you want to see them sooner. If they've had a history of infection, so if they have a fever, things like that, then you're worried about infection of the bone or of the disc itself. And then finally, another thing would be, if you have any symptoms or any history of malignancy, you want to make sure that there's no tumor in any of the spine. So you'd want to exclude that. So what's nice is the American College of Radiology, or ACR, they've given us guidelines, both for us as radiologists, but also for the ordering clinicians, of when to order certain studies and also what studies to order.
Right.
And it's step by step based off of the acuity and, again, the history that's going on. So in that scenario, to expand on that, there are some patients that you need imaging to be done even sooner. So those patients would include those that have a history of trauma. They need to be seen sooner. If they have any history of infection, so if they start to have a fever, you'd want to make sure that there's no infection in the bone or in the disc. The other one would be if they have any history of malignancy or cancer. You want to make sure that there's no tumor that's causing pain that's in the spine.
Right.
And then finally, the scenario where people start to have bowel or urinary issues or incontinence, or cauda equina syndrome is one of the things we refer to. In those scenarios, you'd also want to advance how soon you go towards imaging. And one of the things with us at Radiology Specialists of Florida, or RSF, working with Florida Hospital, we're able to offer that imaging and do it at the highest of standards with the best technology and fellowship-trained radiologists as well.
Excellent.